Dr. Matsuledi, a very good morning to you and thanks for your time. Tell us what this parliamentary caucus is actually going to do in the fight against tuberculosis.
Well, members of parliament make laws, they check budget, they motivate their communities, they've got constituencies, and they must help us in the global fight against tuberculosis. I'm sure, Yuveka, you might be aware that on the 26th of this month, at United Nations General Assembly, there's going to be a special high-level meeting of heads of state where they are going to discuss this global TB problem. And each country is expected also to bring members of parliament because we want the fight against TB to be done by health activists, scientists, politicians, and leaders all over the world.
So you are going to be including the people on the ground, the people who actually work with TB sufferers, because, Minister, I mean, you know, there's always been criticism that we have talk shops, we have countries that cooperate, but does it actually help the people on the ground, those who are suffering, especially when it comes to accessibility to treatment?
Yes. As I'm said, we want the fight, in the fight against TB, to be scientists, health activists, leaders, politicians, members of parliament, business, religious leaders, traditional leaders. We want everybody, by the way, because, as we said, the reason that is going to United Nations is because TB has become #1 killer of all infectious diseases in the world.
Now, we understand that we've also made world history when we announced that the drug-resistant TB patients would now be able to receive a new type of medication to help them. Tell us more about that.
Yes, there's betaguline. People who were on drug-resistant TB used to receive in the arsenal of treatment because they receive lots of drugs, but amongst them was an injection called kanamycin, which they had to receive every day for 18 months. Now you can imagine that is torture. But on top of that, it had serious side effects like ototoxicity, meaning it completely kills your hearing. You know, you may get cured of TB but no longer hear. So now it has been replaced with a new drug called betaguline. And yes, it's true, we are the first country to use betaguline in a general TB program. But we also have the highest number of people in the world who are on the new drug called betaguline. But thirdly, we were able to use the issue of our numbers in South Africa to reduce the global price of betaguline, which used to cost $900. We were able to negotiate it for $400 so that there is a lot of access for people to it.
Okay, so those who need it and those who are not in the suburbs and those who are not middle class, Minister, will be able to have access to this drug. How will they be able to afford this?
I don't understand your question when you say those who are not middle class. Our TB program in government doesn't... Hello?
Do go on.
Hello?
Yes, Minister, my question to you was those who are not able to afford it. I mean, there are those who are middle class, those who have money, who might be able to afford this new drug. You say you managed to negotiate a lower price, but what about those in far-flung areas? They'll be getting this drug free. Will it be a free treatment for them?
Yuveka, TB is treated by the state. It doesn't choose your socioeconomic status. Anybody who has got TB is treated by the state in this country. It doesn't matter whether it's a billionaire or what. The private sector doesn't treat TB. And in the state, we don't choose between socioeconomic groups. We treat everybody who is sick. So this drug is available to everybody who has got MDR, whether it's a millionaire or a billionaire or a pauper. As long as they've got MDR TB, we will put them on this drug. Because as I'm saying, I'm repeating because people might not know this, it's only the state that is treating TB in South Africa. There's no other private institution which treats people with TB.
And I'm sure that's very, very good news for those who might have not known that, Minister. Thanks for clearing that up for us. But we know that tuberculosis does not exist in isolation. There are many other factors also that affect treatment and how somebody lives with this illness. Things like HIV and AIDS, things like housing, other issues, and socioeconomic matters. As much as we say socioeconomic issues don't affect how somebody lives with tuberculosis.
Precisely, you are right. TB affects everybody. As you know, our icon, Tata Nelson Mandela, did suffer TB. Bishop Desmond Tutu did suffer TB. I understand we are going to interview Tamarine Green, the reigning Miss South Africa, who also had TB, and she's going to be talking about it. Yesterday, I had TB ambassadors, which stretches from Prince Hlanganiso Zulu, the son of the king, King Zwelithini, and I had many other celebrities, including the Deputy Speaker of Parliament, who also, at some stage did suffer TB. So it's a whole lot of people who have suffered TB before, but it's largely a socio-economic disease. And we know people who are vulnerable. Number one, we call them key population. Number one are people in correctional services. Number two are people working in the mines, especially in the gold mines. Number three are peri-mining communities, or people who are working, who are staying around the mines. They are not working there, but they are staying around the mines. And of course, you are right, people who are HIV positive have got 3 times a chance to get TB. That's why most of them, even before getting TB, we put them on a drug called isoniazid, or INH, and I'm happy to announce that South Africa is #1 also. It has got more people on INH than any other country. INH is preventative. You're just putting people on that drug to prevent them from getting TB. Those are people who are HIV positive. We also know that people who are diabetic stand 5 times a chance of getting TB. People who have got silicosis, who are working in the mines, have got 6 times a chance of getting TB. And people who have got both silicosis and are HIV positive have got 18 times a chance of getting TB. Then we also talk of people who stay in informal settlement where ventilation is not good. All those I've mentioned, we call them key populations, and we're going to target them specifically.
Oh, wonderful.
But also health workers. Yesterday when we launched, yes, we had a number of doctors there who have had TB, and all of them got it from their patients. So health workers are also a key population.
All right, very encouraging news indeed. And I wish you all the luck. Thank you very much, Health Minister Dr. Aaron Motsoaledi. And as